Hi everyone, my name is Reynaldo Celestino and I will be presenting Neuman's systems model. First off, I will talk about the theorist and her interests, as well as the foundation, assumptions, and concepts of her theory. Furthermore, we'll talk about the meta paradigm and the main concepts and components of her theory. And lastly, I'll try to tie in kind of wrap up the whole topic and the systems model and discuss how nurse practitioners have used this theory into their practice and how much success they found. I know as future nurse practitioners, we hear about these theories and we read about it. I mean, we study about these theories, but it's kind of hard to read about it and try to incorporate that into practice. So hopefully this presentation will kind of help all of us see more in depth of how this theory uh, can work for us if we decide to incorporate it into our practice. Betty Neuman was born in Lowell, Idaho in 1924. She earned her diploma as a registered nurse in 1947. She would end up getting her bachelor's in 1957 and master's from the University of California in Los Angeles in 1966. She would later in 1985 would receive her doctorate in clinical psychology from Pacific Western University. Betty Neuman was influenced by her mother, who was a rural nurse, and also by nurses who took care of her father after he had been hospitalized multiple times for kidney disease. In 1967, she began teaching at UCLA and was in charge of coordinating the Community Mental Health Consultation Clinical Specialist program. During this time, it was that Betty began to have an interest in the development of a framework to help establish roles for nurses. Initially, it was to help students explain their actions and rationales, and as well as making sure they understood that for every action they had there was always a consequence. The initial interest then result, this initial interest then resulted in development of her theory for clients who were in need of health care. Betty Neuman has worked as a nurse, teacher, writer, and consultant, and even though she is retired, she continues to give lectures, writes, and continues to do consultations. She has worked with mentally delayed children in stress reduction programs as well as self-help programs. The foundation of Newman's system models is quite simple. The main goal is of the series to maintain stability and integrity. The system is open to the environment of the client. This in turn can add stress to a client, leading to instability. Neumann considers the theory to be focused on wellness that is holistically focused on the client. The theory is based off a number of assumptions that are considered universals. These assumptions are clients are dynamic. There is variability in a variety of relationships, client response, stressors, as well as nurse actions such as primary, secondary, and tertiary prevention. The main underpinning of this theory is acknowledging that a client encompasses more than just the given stress. It encompasses four dimensions: a person, a family, a community, and a social issue. In addition, it also encompasses concepts by Neumann that include basic survival factors that are universal and unique to the client. This is considered the core in which innate factors happen. The line of defense are just that, defenses to stressors. Environmental stressors first attack the flexible line of defense, and it is a buffer to the normal line of defense. Neumann describes the line of resistance as the mobilization of white blood cells of the body to environmental stressors. This line protects the core structure of the client. And with that, there are the stressors that can be internal, interpersonal, intrapersonal and extrapersonal, as well as the environment, health, system integrity, as well as the prevention by nurses, and in the end, hopefully, the reconstitution. So, what does this all mean? As you can see, this is a very complex uh, system theory that incorporates not just one factor, but multiple factors. In order for us to, as nurse practitioners, we must realize where is the shortcoming, where is the issue for the patient or the client. Is it more than just the stressor? Is it the environment? Is it their poor flexible line of defense, or that line of resistance isn't as strong? This is where we are called to do something for our patients. So like I mentioned earlier, the meta paradigm includes four concepts: person, health, environment, and nursing. Person, we look at them as a whole, so we incorporate the health, whether they're ill or they're well, their environment, and then the nursing action. What are we doing? Are we helping them prevent? So primary, secondary, or tertiary prevention. So the main concept of the Neuman systems theory is to kind of just encompass not just the issue, stress, or illness, but to look at the patient as a whole. And while, as you can see, it incorporates a lot of little pieces that can be complex, but sometimes that is what we as practitioners need to focus more on versus just to add on more about the meta paradigm area. There's also paradigmic origins that Newman's theory incorporated. So it wasn't just one theory that she just created. She kind of took from multiple theories and kind of combined them together so that she could come up with her most uh, original theory. So she used Chaplin's preventative function. So this is kind of the she defined the levels of action for nurses. There's also Chardin's conceptualization as a whole, so just seeing the patient as just a whole, incorporating all these other complex environments, as well as Putt's application of a systems in theory, which incorporated a lot of the ideas and adaptations of the environment. Also, the Gestalt psychology, in which there's the interactions of people and their environment, and she kind of used that to kind of help mold this model that she ended up created, along with some Marxist ideas of the synthesis of man and environment. So she relied heavily on these sources in order to kind of bring about her model, and in turn ended up being a highly abstract and deductive theory that kind of can be used in multiple areas, not just mental health or community health. One thing I forgot to mention was another influence that Newman's model had, and it was the general adaptation syndrome. And this syndrome specifically talks about how we as humans and other animals have a specific response to stressors. And these stressors are usually in four stages: the alarm, resistance, I'm a big fan of pictures and diagrams because for me it's easier to see. I'm a visual person. However, with this Neuman systems model, as you can see, there's a lot of components and it can make for a very complex diagram to kind of overwhelming, let's just say. But one of the major components of this theory is that the main concept being the person. And with the person, there's five variables. There's a physiological, there's psychological, social, cultural, developmental, and spiritual. The spiritual variable was the most recent variable added to this system. This is also a system-based approach. So the way I can only explain it is that it kind of like the body, we have so many things going on in our body to kind of keep us living. And if you look at the center of the circle where it says the basic structure, energy, resource, this is what we are made out of. This is what keeps us, as you know, alive. And we got the lines of resistance. This is kind of our defense mechanism, the one that gets kind of our last defense wall that we have. Then we got the normal line of defense and the flexible line of defense. In theory, the flexible line of defense is usually where the stressors first kind of try to attack that basic structure. And this is where, for some patients or clients, this is where they start to feel the imbalance, the instability. And then on the left side of this diagram, we see the primary prevention, secondary prevention, and tertiary prevention. These are the actions so that as nurse practitioners, we could try to do for our clients in order to get us back to a stable reconstitution area. So as you can see, this systems model is very complex, but once you kind of see the basic nature of this, it kind of rolls really well with whatever you want to incorporate this theory in. So now we get to the portion of where we see this theory, the theory of Newman's systems model in practice. So why did I choose this model? Why I chose this model, specific this theory, is because it's so broad and it can have multiple points of view to one issue. It allows us to encompass more of the patient in order to have a better view or understanding. So better understanding for our client or patient. So initially, when I first began to first study this theory model, I found myself trying to understand how can I incorporate some parts of this, how can I incorporate some parts into practice, or how relevant is it for us as providers. After much reading, I found that this model is a perfect model for just about anything, and that in a way it was hard to just pick some pieces of this model. The reason I state this is because you really need all of the model to see significant changes. I'm sure you're all wondering about examples of this theory being used in the real world. So I found three areas in where they found Newman's systems model very useful for specific applications in practice. So came across three articles kind of using this model specifically for their patients or their clients that were even more specific. So Lee writes about the application of the Neuman systems model for the management of asthma for patients. In his example, he had a case study of a 35-year-old Indian woman who presented to the ED for shortness of breath secondary to upper respiratory infection. She did have a history of asthma and was found to have multiple triggers and had been on some asthma medication. She did have comorbidities such as OSA, GERD, and obesity that can also be contributing factors to poor control of asthma. So the whole idea of Lee using the Neumann systems model was he used it for interventions. He was able to use interventions at different stages of the disease with primary prevention, secondary prevention, and tertiary prevention. Usually the primary prevention is during or immediately after an episode of the disease. Secondary prevention is kind of the recovery and kind of going towards the recovery end. For tertiary, it's now you're stabilizing, you're trying to keep stable. This kind of allows us to treat the patient. So for his example, the primary, he chose to decrease the possibilities of encounter with stressors. So trying to stay away from those triggers, and for her it was ended up being the flu. Secondary is strengthening the lines of defense, so decreasing those risk factors, losing weight, um, eating well, trying to minimize those risk factors. And then the tertiary prevention included, this is kind of the reconstruction of the normal line of defense. It's about readaptation, reduction to prevent further occurrences and to maintain the stability. For her, it was asthma, clinic follow-up, and oral corticosteroids for 7 days. The next example is an article by DeMeyer and Platten on the impact of Neuman systems model on reducing care burden on primary caregivers of patients with dementia. So they used this model and they found that the primary care providers are the basic structure of the model. They were able to see that the primary caregivers were experiencing some physiological, psychological, social, cultural, and spiritual stress. So they enacted to do some secondary prevention, which was provide training to these primary caregivers. And then tertiary prevention was provided by requiring them to have a support group interaction. And they found that the interactions were effective and the stresses were retracted back to the flexible line of defense. My last example I have for you guys is the application of the Betty Neuman systems model in the nursing care of patients and clients with multiple sclerosis. So they found that the model was perfect for taking care of patients who have MS. They found that just like the system, patients who have MS are very complex and involve more than just stresses, but it includes environment, their health, their social, cultural, and just a variety of variables. As you can see, these three topics are very different. However, they use the same model, Newman's systems model, to help their patients and clients. So this is why I chose this theory specifically, was because it really works for just about anything, whether it's your patient with MS, patients with diabetes, or patients with mental health disease. It's a very broad theory and abstract, which allows for multiple interpretation. So when it comes to the application of this theory, my main passion is prevention, more specifically to diabetes prevention and management, mostly because that disease runs in my family. Both my grandparents on my mom's side had it, and now my mom has been recently diagnosed with diabetes. So the Newman Systems model has been something that I plan on using specifically for diseases that are kind of life um, diseases, because it's so complex and it requires a lot of different components, a lot of education on the patient for the patient, and a lot of following up, making sure they're getting their A1Cs checked every 3 months. So it's a very structural and is a disease that can be managed correctly. But with that being said, there are, as you can see from the prior diagram of the Neumann systems model, it can be very complex. So it's not necessarily the easiest to manage sometimes for certain patients, because they have their stressors. There is uh, their lines of resistance are weak. They don't have the primary prevention, secondary prevention, and tertiary prevention. So what I've noticed is that just on a personal level, with my mom, when she was recently diagnosed with diabetes, they went through so much information, which was great for her, but there was a lot of stress that was involved with her, that she was scared because my grandfather had died from diabetes. So there was this emotional connection to diabetes for my mom. So when I went with her to go get the education, the education kind of just went through one ear out the other. And luckily, the nurse practitioner who was working with us saw that my mom was a little overwhelmed, uh, ended up rescheduling, and we were able to get the education she needed for her, because it was just so, she noticed that there was stress and was able to kind of step back and see this patient as a whole and acknowledge that there was something else, not necessarily that she was refusing to manage it, but there was another thing, another component affecting her. And hopefully, in 3 months, we will find out what her A1C. She was at a 6.7. So the goal for her, she's already has her goal, and we've talked about certain things, but losing weight. And the best thing that's kind of, I hate to say the best thing, but the best thing for my family that's happened is that my grandmother has it. So now it's my mom and my um, grandma are kind of trying to see who has a better A1C come January, and we think it's a little funny, but at the same time, this um, now they're using each other as a support system, where there's more support on both ends, and which is great for my mom and my grandmother, and just for as a family member, and seeing how on the medical side and then the other side of things, kind of how this specific disease, whether it's especially whether, and as I mentioned earlier, this systems model is great for anything. But I specifically will be choosing this model to write my future papers So I had mentioned how I have a passion for diabetes management and prevention, and Edelman and Lunny do have an article in which they had a case study of a diabetic and how it was a specific diabetic educator who was able to see this patient and use the Neuman systems model to actually find out where was the break in the patient's management, because this patient had been treated. His A1C was, I believe, 11.2, and he had been gained like 20 plus pounds, and then he had been doing well, and then when he came back with his follow-up, uh, it ended up being worse. His A1C had gone up, he had gained more weight, and Edelman Lunny article kind of described how they were able to find that um, it wasn't necessarily the medication. It was the fact that he had increased stress at work, which was causing him to snack more often during his breaks and eating a lot of unhealthy food choices. So for specifically, this system is great because it kind of oversees every component. Like I mentioned earlier, it's able to pick up on whether it's a stressor personally or if it's an environmental stress, and it kind of just helps us as providers pinpoint exactly what is causing the poor management or the poor prevention on their behalf. So it's a win-win for the provider and for the patient if we're able to pinpoint exactly where the break is.